Do you or anyone you know feel very tired, helpless, or hopeless?
Have you or anyone you know lost interest in many activities that you previously enjoyed?
Are you having trouble working, sleeping, eating, and functioning?
Have you felt this way day after day? If you answered yes, you may be experiencing depression. Everyone feels sad from time to time. However, these feelings are short-lived and last only a few days. Depression is where these feelings are severe or long-lasting. It leaves you feeling down most of the time and finding it hard to cope from day to day. Depression is increasingly common, affecting 1 in every 10 people. It affects 1 in 5 over the age of 65. Depression is not a normal or necessary part of aging. As you get older, you may go through a lot of changes. Death of loved ones, retirement, stressful life events, or medical problems. It's normal to feel uneasy, stressed, or sad about these changes. But after adjusting, many older adults feel well again. Depression is different. It is a medical condition that interferes with daily life and normal functioning. Depression is a common problem in older adults. It is not a sign of weakness or a character flaw, and its symptoms affect every aspect of your life, including your energy, appetite, sleep, work, hobbies, and relationships. Unfortunately, all too many depressed individuals fail to recognise the symptoms of depression, or don't take the steps to get the help they need. There are many reasons depression in older adults is so often overlooked. You may assume you have good reason to be down, or that depression is just part of ageing. You may be isolated, which in itself can lead to depression, with few around to notice your distress. You may not realise that your physical complaints are signs of depression. You may be reluctant to talk about your feelings or ask for help.
The general rule of thumb is that an individual can be diagnosed with depression if they experience 5 or more depressive symptoms for more than 2 weeks. Depressive symptoms include feelings of overwhelming sadness and hopelessness, loss of interest or pleasure in everyday activities or hobbies that are usually enjoyed, sleep disturbances. Older people need less sleep. However, if you notice a dramatic change in a short period of time, or that you're not waking up feeling rested or having difficulty sleeping, waking early and not being able to fall asleep, feeling overly tired or having no energy to get out of bed, these could be signs. Changes in appetite, often reduced appetite and weight loss, but increased cravings for food and weight gain occur in some people with depression. Feelings of hopelessness or helplessness, having recurrent thoughts of death, suicide, or self-harm. Cognition, some people think that it is part of ageing or that they have dementia and are afraid to look into it. However, poor attention and concentration can be part of depression. Never assume that a loss of mental sharpness is just a normal sign of old age. Feeling restless, worrying more than usual, feeling panicky, loss of self-worth, worries about being a burden, feelings of worthlessness or self-loathing, dwelling on bad times from the past, slow movement and speech, neglecting personal care, skipping meals, forgetting medications, neglecting personal hygiene. All of these may be signs of depression. While depression and sadness might seem to go hand in hand, many depressed people claim not to feel sad all the time, or at all. They may complain, instead of low motivation, a lack of energy, or physical problems. In fact, physical complaints, such as arthritis pain or worsening headaches, are often the predominant symptom of depression in later life.
Some people may ask themselves, as they grow older and experience loss, is it grief or depression? As we age, we experience many losses. Loss is painful, whether it's a loss of independence, mobility, health, your long-term career, or someone you love. Grieving over these losses is normal and healthy, even if feelings of sadness last for a long time. Distinguishing between grief and clinical depression isn't always easy, since they share many symptoms. However, there are ways to tell the difference. Grief involves a wide variety of emotions, with good and bad days. Even when you're in the middle of the grieving process, you will have moments of pleasure or happiness. With depression, on the other hand, the feelings of emptiness and despair are constant. While there's no set timetable for grieving, if it doesn't let up over time, or extinguishes all signs of joy, for instance, laughing at a good joke or appreciating a beautiful sunset, it may be depression.
You may ask yourself, what if it's not depression? What if it is dementia? Symptoms of depression are sometimes similar to symptoms of dementia. However, symptoms of depression, you tend to notice that your mental decline tends to be rapid, whereas in dementia, your mental decline tends to be much slower. Patients that suffer with depression tend to know the correct time, the correct date, or where they are, whereas patients with dementia are often confused and disorientated and become lost in familiar locations. Patients suffering with depression often have difficulty concentrating, whereas patients with dementia tend to have difficulty with short-term memory. Language and motor skills are often slow but normal in patients with depression. In contrast, writing, speaking and motor skills tend to be impaired with patients with dementia. Patients with depression often notice or worry quite a lot about their memory problems, and in contrast to this, many patients with dementia don't notice memory problems or seem to mind or care about their memory problems. Other causes of depression. It's important to be aware that medical problems can cause depression either directly or as a reaction to the illness. Any chronic medical condition, particularly if it is painful, disabling or life-threatening, can lead to depression or can make the depression worse. These include medical conditions such as Parkinson's disease, a stroke, a heart attack, cancer, diabetes, thyroid problems, or multiple sclerosis. Symptoms of depression can also occur as a side effect of many commonly prescribed medications. While the mood-related side effects of prescription medications can affect anyone, older adults are much more sensitive because as we age, our bodies become less efficient at metabolizing and processing these drugs. Medications that can worsen depression include beta blockers, sleeping pills, tranquilizers such as Valium and Xanax, medications for Parkinson's disease, ulcer medications, steroids, and estrogen preparations. If you feel depressed after starting a new medication, make sure to talk to your doctor. You may be able to lower your dose or switch to another medication that doesn't impact on your mood.